When I went for my mammogram, I wasn't nervous. I was forewarned by my gynecologist that I would probably get called back since they didn't have a baseline mammogram. They did a more in-depth one as well as an ultrasound. After the ultrasound, they wanted me to speak with a radiologist, and he said that he saw something that was suspicious and said that he thought I should see a surgeon. Immediately, they took me right upstairs.
Allyson came to me after having her first mammogram done, which showed abnormal microcalcifications. A microcalcification is something that we look for on mammograms that can sometimes indicate that there's an underlying cancerous process going on. The ultrasound-guided core biopsy showed an estrogen and progesterone positive, HER2 negative invasive ductal breast cancer.
I found out it was cancer on June 2nd, 2015. I felt like in the movies, everything around me was spinning. And of course, when you hear you have cancer, the first thing you think of is worst case scenario.
Her particular breast cancer was diagnosed when it was very small, so she had a very early stage breast cancer. I recommended that we proceed with breast conservation therapy. This includes performing a lumpectomy of the actual mass and then administering radiation to that area.
When Dr. Guilfoyle removed the tumor, she found that one of my lymph nodes had cancer. Because of that, the course of treatment changed a little. Instead of just lumpectomy and radiation, she advised that I have chemotherapy as well. I worked through my chemotherapy and radiation treatments. It knocked me out a bit. It made me very tired, but I still needed to go on with my life.
Allyson is a very strong woman, and this helped her deal with her treatment very well. Early detection is so very important because the earlier the stage at diagnosis, the less treatment that is necessary.
I regret not going for my mammogram at the age that I was supposed to start going. But I realize now that the older you get, you really cherish your life and you need to do everything you can in order to prevent things from happening.